The COVID-19 crisis had devastating effects on households and children worldwide. And estimations from 2020 show that in the Middle East and North Africa, over 12 million children could have been pushed into multidimensional poverty as a consequence. As we all know, robust social protection systems are an integral tool in protecting children and families from such shocks, something which governments in the region recognized and based their actions in response to the pandemic. Across the region, governments expanded existing programs, in some cases within weeks, launched new ones, and adjusted design features given the unique realities of the pandemic. UNICEF supported many of these. It is now important that lessons are drawn from these responses to develop recommendations for strengthening national social protection systems, particularly to ensure that they are systematically inclusive of the needs of children and other vulnerable groups, prepared to effectively respond to crises, and underpinned by delivery systems that can enable integrated responses to multidimensional deprivations. UNICEF MENA, in collaboration with IPC-IG, is therefore pleased to launch this first ever comprehensive assessment analyzing both overall design and implementation features of COVID social protection responses in the region, such as timeliness, coordination, adequacy, and financing, as well as, very importantly, child sensitivity of these responses in terms of targeting, benefit design, and linkage to other services.
We're very happy to be launching today the report Social Protection Responses to COVID-19 in MENA, Design, Implementation and Child Sensitivity, developed by the IPC-IG in partnership with UNICEF MENA. The aim of this study is to provide an overview of the main design and implementation features of the social assistance measures implemented in response to the COVID-19 crisis in the region, and the extent to which those responses were sensitive to the needs and vulnerabilities of children. And why is this study relevant? Well, first of all, as we all know, children are among the most vulnerable to the multiple consequences of the COVID-19 crisis. And at the same time, literally all countries in the MENA region have introduced some social protection mechanism to respond to the crisis. And we know from past research that social protection can reduce the negative impacts of economic shock if they are designed in a child-sensitive manner. However, so far, no assessment has been done that actually looked at the child sensitivity of the social protection responses in the MENA region. And another point that makes this study relevant is that besides looking at the government-provided social protection measures, we also analyzed the social protection programs provided by humanitarian actors in 9 of the 20 countries in the MENA region. And this is, of course, important since several countries in the region are facing humanitarian crises.
So what do we find with this report? It presents the different aspects of the social assistance measures implemented in the region. Their financing, how they selected beneficiaries, how many people they covered, their adequacy, and finally, their timeliness. In addition, at the core of the report, we looked at whether programs targeted children, if cash benefits increased according to the household size, and if programs supported children's access to education, nutrition, health, or child protection services. So in conclusion, the report shows that immense efforts were made in the region to contain the socioeconomic effects of the COVID-19 crisis and broaden social protection systems. However, it also highlights a number of gaps of the systems themselves in the region, such as low program coverage, low and ad hoc benefits, and the lack of integration of programs and data. In terms of child sensitivity, governmental programs often did not take into account this group into their design. With this report, we hope that it manages to inform policymakers on how to set up a stronger social protection system that is more sensitive to particularly vulnerable groups, such as children, and better prepared to respond to future shocks.